So thank you all for having been present for this COVID-19 symposium focused on the team care. We are now aware that after having been so much engaged in the management of patients infected with COVID-19, their family members, the healthcare providers have authentic not only symptoms but now syndromes like general anxiety, depression, burnout, and also post-traumatic stress disorder. And we know that these syndromes have been generated by the surge, by having to deal with so severe patients, by workload, and also by all the psychological burden coming from dealing with very sick patients with high probability of mortality, absent family members who were not allowed at many places to visit the patient and to take part to the daily rounds. And this has really created an ambience from definitely that is the reality and from which we need to understand how we can improve the experience of patient and family members and healthcare providers, and what we can do if this is going to come again. Clearly, we know that there are preventive strategies that should be tested. We also know that the outcome of these interventions are mostly related to quality of life, to post-traumatic stress disorder, to burnout, to moral distress, to the intention of leaving the job of healthcare provider. And we know that in a close future, a follow-up will need them to assess again these symptoms, maybe a year after the last patient with COVID-19 managed in our ICUs, and it will be very interesting to have longer time outcomes and to understand this experience of managing COVID-19 patients. Thank you very much, and it was a privilege to be with you for this symposium.